Hi all, I'm Dr. Sushma, consultant pediatric rheumatologist, family rheumatology in Bangalore. Fever is a very common concern among younger children. It's not just the children, and the parents also panic whenever their child gets fever and they rush to hospital. Fever is the body's way of telling that there is something wrong in the body and the body is fighting against it. Fever is very common and it can be because of various reasons. The common reasons being infection, sometimes an inflammation, and more serious causes can lead to fever. Viral infections are very common among the infections that happen in children. So, whenever a child gets a fever, so how do we say this fever is that? When we check the temperature with a thermometer in the armpit, if temperature is more than 100 degrees Fahrenheit or 38 degrees centigrade, we call it as fever. And whenever there is an infection, for example, viral infection, the fever, the frequency, and the intensity, it will keep decreasing as the day progresses. As in, the viral fever is a self-limiting condition. So there can be continuous fever for a period of 3 days, and there can be associated other symptoms like running nose, body pain, and other kids in the same family can also have the similar symptoms or could have had contact with a child with fever in school or playgrounds. And after a period of 3 to 4 days, the frequency and the intensity of the fever keeps on decreasing, in that the child becomes all right in between the fever, and only during fever the child will be dull. And by a period of a week or maximum 10 days, the fever completely goes off and the child is totally fine. But sometimes there can be other focuses of infection during this period, and there can be other symptoms of bacterial infection. For example, a sputum, a cough with sputum, a tummy pain with loose motion with blood, or vomiting, headache. And if the child is very tired, the child is sick in between the fever also, and the fever intensity and frequency keeps on increasing as the day progresses, we think of bacterial infections. So when we think of bacterial infections, depending on the uh, symptomatology and the infection that we are suspecting, we prescribe antibiotics. And if the bacterial infection is responding to the antibiotics, fever subsides. This is a common course. Any parent would have gone through this once or twice. But if the fever goes on to persist and does not subside even with antibiotics, or if there are no focus of infection like cough, cold, vomiting, loose motion, it's just the fever that is continuing, or if the fever is associated with other features like excessive tiredness, decreased appetite, loss of weight, mouth ulcers, and hair loss, or decreased energy, or rashes over the face or body, and even joint pain or swelling, one must think beyond infection. It could be because of inflammation that is going on in the body. Inflammation is the body's uh, mechanism to get over any threat to the body. Sometimes this inflammation goes on to affect our own body tissues and damage and cause these symptoms. And this is called as autoimmune or autoinflammatory condition. So whenever a child has a prolonged fever that is not responding to antibiotics or has any of these symptoms, one must consult a pediatric rheumatologist. Sometimes, rarely, children may have these fever episodes very frequently after a period of time. And this recurrence can have a certain periodicity as well. We can even predict that the child is going to have fever after certain like 3 to 4 weeks or so. And when the child gets fever, there can be other symptoms like abdominal pain or throat pain, rashes, or even joint pain or swelling. And it may last for 2 to 7 days. But in between these episodes, the child is absolutely fine. These are called as recurrent fever syndromes or autoinflammatory syndromes, which can also occur in children. So when you see that your child is having these recurrent fever episodes, that is happening almost at a predictable date, or also has other symptoms such as joint pain or swelling or tummy pain or throat pain or rashes, you must consult a pediatric rheumatologist. When you do, we see that if it is a persistent infection that is going on to cause the fever, sometimes, rarely, these in some certain rare infections can cause prolonged fever. And also, tuberculosis is common in India and can be the reason for prolonged fever. If that is the case, there can be other associated symptoms as well. So when you do consult a pediatric rheumatologist, we see if the fever is because of an infection or an inflammation that is causing the fever, or if it is due to other sinister causes such as cancer. We go through the history elaborately, and then we go do a thorough physical examination wherein we see if there are any other signs of inflammation in the body. And also we rule out if there is any infection or any other serious causes. And we run certain blood tests that may include autoinflammatory tests, as in we do blood work to see the level of inflammation in the body. That we can see by running many blood tests, particularly ESR and CRP. CRP, especially in these inflammation, and ESR can be high because of increased inflammation that is going on in the body. And depending on the condition that we are suspecting, we run some certain autoimmune blood workup as well. And depending on those blood work and the organ that is affected, we may run certain imaging tests as well. Once it is uh, diagnosed as an autoinflammatory or autoimmune condition, we have an options of multiple medications, physical therapy, and an holistic approach to control this inflammation. If you see that your child has fever that is continuing for a long time, or if it is occurring repeatedly, or if there are other features like tiredness, low energy, joint pain, swelling, rashes, mouth ulcers, or tummy pain, do not hesitate to consult a pediatric rheumatologist.